So it is called jaw segmentation. For that,
is this the occlusal plane?
it's prosthetic plane. It's made by the program, and
Sorry, can you explain it? What do you mean prosthetic plane?
prosthetic plane is, I guess, that's what we call the idealized occlusal plane. So
If
it's
you do this plane, it will be okay, Panayotis.
well, more or less. Actually, look, this plane shows that his molars are not in good position. But this is not, I will show you, that this is not a plane you would use for your work. This is a plane you use here for what is called, I will show, advancement, detachment of lower jaw. So for that, we have to decrease the size of the prosthetic plane, that it will slightly be inside the ramus of the mandible. So it slightly. And then you remember we placed a point, red point on lower jaw in basic cephalometric analysis? That will help us to do this. Detach lower jaw. Oh, we did it from first place. Very good. Because the CBCT is very good. It's very precise. If you don't like the way detached, for example, it will be too small, you can, here is expand selection. And you can expand until you reach a nice position. Then you did it, you finish. And right now, it's time.
Can I see something? Παναγιώτης, για ένα λεπτάκι. Για κάτσε λίγο εδώ, έτσι, και χαμογέλα από την οθόνη.
You see this too?
Yeah.
Uh-huh. But I don't think
it's better. It's perfect. His occlusal plane is
inclined.
Yeah.
Mm-hmm. But I did it not very good because I didn't use it with a fork. With a fork it will be 100% precise. Okay. But anatomically speaking, the fork is very easy to place in the model, and I remember that there was contact between anterior teeth and the fork, and I use it as a reference when I was doing it without the bite fork.
You didn't use it here, or what?
Because the quality of the scan was bad.
Okay.
So, and if I remember, I was using just the fork, and I was manually placing the model of the upper jaw. But because remember I told you it's better to have contact between incisors and the upper fork. Bite fork.
Okay.
Because I remember the position, and I remember the relative position according to the T-line. So I placed the anterior teeth in the contact, and posterior teeth were hanging. But I think that helped me to be precise.
Okay.
Can I ask you another question?
Yes.
It's for the prosthodontics. Let's say that for Panagiotis we're making full restorations, full mouth rehabilitation. And we're following this occlusal plane. But Panagiotis, when he's smiling, his lips are the other way. His social smile is like that.
With lip, you could not control it by occlusion 100%, but lip could adjust. So if the patient has, for example, his smile is canted, not occlusion. You have to see it and you have to tell it to the patient, but you can't promise that you will change his lips or his muscles. If he would have missing teeth, for example, or want our dentition, maybe you can do that, or with orthodontics. But in case of Panagiotis, like if we do, he has the problem with the bite right now, and even if we do full mouth, we wouldn't change a lot in his occlusion, yes, or in his height. So I wouldn't promise that his muscles would be different, or his display on both sides would be different. It might happen, it might not, because it can be other reasons as well as trauma, or some kind of, not inflammation, but I would say trauma or muscle things. So it's better not to promise that. It's better not to promise. But for us it's more important that there will be harmony with the horizon or with interpupillary line or with smile arc. because if the lip is raising upper on one side or raising less on the other side, well, it could be surgery or fillers or something. I have a lot of patients like this, especially with full mouth rehabilitation, where you see they're smiling and their smile is scanted. You can't use it as a reference, because if you do the occlusion parallel to the upper lip, it will be a problem, and to the lower lip as well. But lower lip could actually adjust. Very often lower lip changes, and sometimes maybe to do the Botox on one side. I didn't do that, but my colleague did it with his girlfriend. He did the whole mouth rehabilitation for her, but she had like a, I would say, paralysis of the muscle depressing angle of the mouth, angular oris, or musculus depressus angulus oris on one side, and he made a Botox on the muscle on another side, and she started to have nice correction of the lower lip because it became symmetrical. Before that, she was talking like, you know, like Rocky. Eventually, you will do this for Sylvester Stallone.
Yeah.
He will never do it with the teeth. It doesn't matter. He had a trauma during the birth, so he's part of his nerves are atrophied. So when you detach the lower jaw, right now, if you do any movements, you can see how the condyle moves and the jaw moves as well. What kind of movement is that we're doing right now? That's looks strange because you see the coronoid process was not part of the jaw, but for us it's what's important is the condyles. Look how nicely with this nice CBCT we can see how the condyle moves. And let's try to see what happens, why we see this crazy protrusion in his. Let's see. So I didn't like this joint, yes?
They say suppose it's very helpful for orthodontic surgery, no? When you cut and...
Yes, yes.